All right, Hina Sheth here from Rebalance Physical Therapy and Wellness in Philadelphia, Pennsylvania. And today I'm going to be talking about a muscle called the sternocleidomastoid and how can you tell if it's a problem. Now, I have a previous video where we talked about what issues it can cause. I actually have a bunch of different videos on what issues it can cause, but we're going to talk about how can you tell if this muscle is a problem. Now, number one, what you can tell is if you look at yourself in the mirror, all right? Oftentimes when this muscle is called the sternocleidomastoid, just to reiterate, it's a muscle that attaches to the kind of the back of the head and neck, underneath the ear, and it comes down and attaches to the collarbone. All right. Now, when that muscle becomes a problem, how can you tell? So if you look in the mirror, you're going to kind of be able to see that, hey, is your head kind of tilted to one side and rotated or rotated to one side? And if you kind of see that, oftentimes you can tell because when you've had enough pictures taken of yourself and you look at it and you're like, why is my head always tilted to one side? Well, guess what? That could be your sternocleidomastoid muscle. All right. You can tell because this muscle, when you turn your head, you can see it's kind of looks like this ropey muscle that goes from the collarbone all the way up kind of behind around the ear. So that muscle, when it is tight, it will tend to pull your head into that direction and it'll rotate it to the opposite side when it becomes tight. All right. So if my right sternocleidomastoid was tight, it's going to pull my head to the right. It's going to turn my head to the left. So if you see yourself in the mirror and that's what's happening, number one, you can kind of tell, there might be something wrong with that muscle. The other way that you can tell is simply by touching it. So if you kind of feel right behind the bottom part of your ear in that bony area, and you kind of just feel that muscle coming down from the side, you follow it across down to where I said it attaches kind of to the collarbone right here. It also attaches to the sternum, which is right in through here. If you feel along here, does it feel different from one side to the other? Does it feel tender? You can kind of also gently strum across the muscle and see, does it feel different from one side to the other? So you can tell. And if it's tender on one side to the other, then that muscle can be problematic. Now, if you are having symptoms of sternocleidomastoid kind of referral, all right, and this muscle can actually refer pain up into the head, into the neck, behind the eye, then sometimes when you're feeling around that muscle, it can actually reproduce some of that discomfort that you might be having. So those are two strategies to be able to tell if you have a sternocleidomastoid issue. Now, in the next video, we're going to talk about how to treat it. Now, if this video was helpful for you, please like it, subscribe to our channel, and check us out. But hop to the next video. We're going to go into a little bit more detail on how you might be able to kind of self-treat this muscle a little bit on your own.